So our final presenter for today is Peter. Peter has been with the NIDA CTN for over 5 years. He is a member of the Greater New York Node at New York University School of Medicine and has participated in CTN research at the Bellevue Hospital Center site in New York. He helped coordinate the Bellevue team on the CTN 51 trial and is currently working on the CTN 79 trial. Prior to joining the CTN, he worked as a counselor in an all-female alternative to incarceration substance use treatment center in Harlem. All right, Peter, take it away.
It's a pleasure to be able to present to you today on this really interesting and important topic. So, if you followed all the excellent advice reviewed by my fellow presenters, you may find yourself fortunate enough to be poised to conduct a visit with an incarcerated participant. So, what's next? My goal here is to provide guidance on how to prepare for and conduct actual visits in correctional facilities with an incarcerated participant. And because the correctional setting is unique and complicated and often poses some significant challenges to conducting research the way that we usually do in an office or clinic setting, I'd like to outline some of the most important things to keep in mind in order to complete your visit and to collect data successfully. So some of those things to keep in mind that's been mentioned multiple times in the previous presentations is confidentiality. Confidentiality can't be stressed enough, and as well as professional conduct in correctional settings, effective data collection, and safety. So your first step is to contact the facility in hopes of gaining access. When reaching out to facilities, it's important to specify that you're looking to meet with an inmate in a professional capacity, which is distinct from the normal visiting hours that are afforded to family and friends. A professional visit is much more likely to provide you with the privacy level and the ability to interact with the participant in a way that would accommodate a research visit and conducting assessments. Calling local facilities is something that can be done early during study startup to begin the process and to learn the lay of the land of the facilities in your area. A reliable contact is somebody who can do things for you, like to obtain a clearance for you to enter the facility, confirm the details of your visit, and give a general outline of how the visit is going to go. In our experience here at Bellevue, departments within a jail that may be able to help you with this include the clinic, discharge planning, and legal offices. These are all settings where inmates would meet with professionals from the community, and they may be well situated to accommodate your request. And lastly, there may be colleagues at your institution who have conducted research in correctional settings in the past. They may have volunteered at jails. They may have also worked at jails. And these folks may be a good group to start with and to reach out to see if they have any advice on how to gain access and any specific contacts they may have at correctional facilities. Moving along, continuing to stress confidentiality, the correctional setting can be a little difficult in maintaining confidentiality, and especially in the way that we hope to during a research visit. And since you're a guest making a request to see an inmate, the staff there may want to know, why should we let this person in and what are they going to be doing? So it helps to be prepared with some answer to these questions. And when speaking to your facility contact to set up the visit, and when arriving at the facility, it's important to remember to never disclose the nature of the visit or the research project that you work on. And if possible, we even try to be restrictive with the fact that we're conducting research at all. And upon arrival, we often say that we're conducting a follow-up health visit and that we're from NYU. And unless we really need to, we may say that we're going to conduct a research visit and giving no further information from that. And as was mentioned before, it's important to confirm confidentiality. So when you're speaking to your facility contact prior to the visit and while you're setting it up, your contact should be able to confirm that no audio or video recording will take place during the visit. If this can't be confirmed or accommodated as per a specific facility policy, then a visit may not be possible. Unfortunate as that may be, it may just be the way it is. And now is also the time to ask about rules and guidelines of visits at the facility, and you can begin to work those into your SOP, and that will continue to develop after your initial visit, as Dagmar's mentioned. So the image you see here is the sign that everybody, including the researchers who are going to conduct visits at the Rikers Island complex here in New York City, see while they're on the bus about to cross the bridge. And before you get to this point, perhaps a day or two before, there's a few things that you can do to help things go smoothly. So, planning ahead for your visit. Leading up to the visit. So staying in touch with the facility contact. Your facility contact is essentially doing you a favor by helping you get access. And they're usually quite busy, working in a hectic environment. So it's helpful to stay in touch with them leading up to the visit to troubleshoot any clearance issues, ask any last-minute questions, and also reconfirm they're expecting you on the scheduled date. The last thing that you want to do is show up and surprise your contact or have the proper documentation not be in place upon your arrival. And it's also a good idea to look at the databases that Amber outlined in her presentation at least a day before your visit, just to make sure that your participant hasn't been transferred, released, and so that and also to ensure that they're not in court. And the day before, you'll want to map out the route to your facility as well as the most efficient method of transport for whoever's conducting the visit to arrive. Preparing for the visit in general, as you learn the specific rules of the correctional facility, as I said before, these can be updated in the SOP to make that a useful and comprehensive document. RAs conducting visits should review and make note of dress code, parking restrictions, what identification to bring, and especially what items not to bring. Having computer access to complete direct data entry is highly unlikely. So bringing blank paper CRFs for all assessments that will be conducted on that day is an important thing to include. And for confidentiality's sake, you're going to leave all existing data and PHI at the study site. And this eliminates the potential loss of any files en route and in transition while you're conducting it. We've learned that patience is key when conducting visits in a correctional setting. So for research staff to have a more comfortable visit, it may be helpful to bring some reading material as well as some snacks for while you're waiting for your inmate to arrive and for the process to run its course. Lastly, it's a good idea to have phone numbers on hand of personnel at your study site. It's most likely that you're not going to be allowed to keep your cell phone on you for the duration of the time that you're at the correctional facility, and you're probably going to want to keep your site staff updated on the progress of the visit. So writing down those numbers and thinking through a way to keep them updated is helpful. On the day of the visit, so you've arrived, you're about to meet with your participant in the correctional setting, and it's important to note that a clean and safe and private workspace is essential for a productive visit. So you'll have confirmed with the facility contact that the visit will not be video or audio recorded. You can see this is a common theme here. However, once you arrive, now is the time to ensure that you don't observe anything that could jeopardize the participant's confidentiality. So if anything seems out of the ordinary, you may want to troubleshoot with the staff and create a proper visit environment. However, if this can't be done, if you notice anything that just doesn't seem right, it's best not to conduct the visit rather than to jeopardize confidentiality in any way. Often you'll be placed in the line of vision of correctional staff with your participant in order to conduct the visit. And this is usually for safety purposes, and we found that this is appropriate as long as there will be no listening in on the visit and there's enough distance between you and correctional staff so that they're not within earshot. On the day of the visit, so getting to the heart of the matter, the reason why you're there is to collect the data that you're looking to obtain. And while your goal is to complete the entire visit, and that any data collected with an incarcerated participant is good to have. As we heard early on, this is important data and is capturing perhaps a part of your sample that you wouldn't want to miss out on. But time can be an issue. Unexpected events could cut the visit short. So it's a good idea to prioritize assessments that contribute to your study's primary outcome and work backwards from there. So while all data we know is important, there may be data that you want to prioritize first, just in case anything should happen. Many studies in the CTN do incorporate a urine drug screen. So you're going to want to have all your supplies for collection, dip cards and testing procedures, as well as gloves and perhaps a Ziploc bag for disposal, so that this can kind of be a self-contained process. The UDS can be a little tricky as opposed to the pen and paper assessments when you're conducting them in a correctional facility. So what we found is that it helps to inform the study staff that you will want to collect a urine sample, and they can guide you on where and how it should be done. Important to note here that while you can inform them that you'll want to conduct a sample, that you're never at liberty to disclose the results of the urine sample to anybody in the correctional facility. That should remain confidential for study purposes. And lastly, in terms of timeline follow-back data and any data reference points that you have in your collecting given a certain time frame, you're going to want to make sure that you've made note of them prior to arriving at the correctional facility, so that you know the reference dates or points for which you'll be collecting data. And since timeline fallback data and other substance use data can be sensitive, it's important to be very cautious with this data, making sure that you keep track of those documents at all times, especially if it applies to illicit substance use while in jail. You wouldn't want to let any information out there that could incriminate your participant. So, after completing the visit, you're going to want to discuss compensation options with your participant. So it's a good idea to refer to your study's reimbursement procedures and SOP for what methods of paying the participant are available to you at your study site. And this can vary depending on the way compensation takes place at each specific site. To give some examples of what we've done here at Bellevue for compensating participants who are in a correctional setting, one of the more popular ones is we've deposited funds into a participant's commissary account. This varies from facility to facility, but it's usually a pretty quick transfer, and some participants really do like that. Others have opted for us to not submit the payment through the correctional facility, rather to send it via money order to a family member in the community, and that can be helpful to them in other ways. And lastly, especially if the participant is expecting to be released soon, just for ease and convenience and lack of red tape, it can be easier if they just pick it up at the study site upon the release, and they may find that to be the most easy. These are just a few examples, and your study site will be able to set up options that are most appropriate for each specific site. So in this last slide, I just wanted to go over some perhaps questions or topics that might arise, especially if conducting visits in a correctional setting are unfamiliar. So just touching on some of the main ones here, is it safe? Generally, I can say that it's as safe as working in most of the other settings that we have conducted research in. If you follow your study's standard operating procedures for staff safety, always staying aware of your surroundings, those are a good start of maintaining safety while in a correctional facility, as well as following all the rules, not deviating from any of that. And I think most of the time we've never had any problems, and that's all the time. So most of the time, it's really safe. And if you have any questions, I think you can always ask correctional staff, and they should be able to guide you and make for a safe visit. How long will it take? This varies. However, we usually factor in at least a day, half a day for the staff member that's going. We find it best to go first thing in the morning so that one shift isn't unnecessarily extended in case any delays do occur, and they often do. And how do I stay in touch with a participant and schedule the next visit? So since you're with the participant in that moment, now's the time to start planning for your next follow-up visit, if applicable. So you can discuss with them where they might be when their follow-up window opens. This can help with the retention and tracking process. Don't forget to give them a reminder card if the facility rules allow for that to take place. And lastly, what about phone visits? So we talked a little bit about phone visits in the previous presentations, and they can be a good option, especially if somebody is incarcerated a great distance away from your study site, or for some reason an in-person visit is not possible. A phone visit may be a really good option. And so most of the processes that I've outlined, especially in terms of confidentiality, collecting data, and prioritizing important data, usually also apply to phone visits. A couple things, though. You'll want to confirm with your contact that the phone line that you'll be using will not be recorded or monitored, and also be prepared to confirm the identity of the participant who you're speaking with. Otherwise, I think normal phone visit procedures that you would conduct with a participant who's not incarcerated would apply. On the right-hand side of the screen, you can see just a list of items that kind of summarize the steps of doing a visit with an incarcerated participant. So I hope that these are helpful and touch on some of what I have discussed in my presentation, as well as a couple additional finer points. Here's my contact information. I'd be happy to take any questions after this presentation concludes at any time. And thanks so much.